Hey, Dr. Tyson, pediatrician. Let's talk about skincare routines for acne-prone teens. The biggest mistake that I find that teenagers make is not following something consistent. So they try something, they feel like after a few days it doesn't work, they don't use it, then they come in and say it's not working, we prescribe something stronger, it irritates the skin. So it's this vicious cycle and the acne never really improves. The other mistake I see, which is a little bit more recent, is an overly complicated skincare routine where there's multiple steps and they're using things that aren't really appropriate for their skin type or concern. So I wanted to give you a very simple, easy to follow, but really effective skincare routine to start with for acne, and then let you know when is a good time to see your primary care provider or dermatologist. So the first things to remember is to wash your face twice a day. If you have really dry skin, you can wash it once a day, but I would start with twice a day. Just use a really hydrating cleanser. Examples would be La Roche-Posay, CeraVe, Neutrogena, something that says hydrating. If your skin is really oily, then you want to see something that says foaming. So trying a really good cleanser, double check that it's not too strong for your skin. If your skin feels really tight after using it, try something a little more hydrating. After you wash your face, make sure that you're using a clean towel to dry off, and it's one use only. So I usually say go ahead and get like a pack from Amazon that has like 100, really, really inexpensive washcloths every single day. Every time you wash your face, use a fresh, clean towel to dry it off with. In the morning, you're going to use a combination moisturizer and sunscreen. One step is going to be easier to follow. And so what you want to remember is acne-prone skin needs moisture. Even if your skin is oily, you need that extra moisture or your skin is going to make more oil. So giving it something that's non-comedogenic or non-acne prone moisturizers is better than allowing those pores to make more oil. The reason that you need a sunscreen every day, first of all, prevents skin cancer, but also prevents the hyperpigmentation or scarring from the acne. And that's the part that we live with forever. So you really want to make sure that you're using a daily sunscreen combination with your moisturizer. That's it for the morning, nothing else. When you get home in the afternoon or evening, whether it's from school, sports, work, whatever it is that you're doing, wash your face immediately. If you are someone who wears makeup, using an oil-based cleanser first and then using another face wash afterwards, so like a double cleanse method. After you wash your face, you're going to start with an over-the-counter benzoyl peroxide. They have like pads, like astringent pads. Sometimes they have something you pour out onto a cotton swab. It's something very simple, put over everywhere that you have the acne, including your chest and back and arms. Let that dry for just a second and then use a nighttime moisturizer. It's going to be a little bit thicker than what you have in the morning because it's going to stay on all night. If you have very oily prone skin, think of something like gel-based or something more lightweight. If you have more dry skin, using something a little bit thicker. Again, using a towel that is completely clean, one use only. When you go to sleep at night, make sure that you are having a fresh pillowcase every single night. A quick and easy way to do this is when you do your laundry, put on 3 pillowcases. Every night, turn the pillowcase over. The next night, take the pillowcase off. And that way you're putting your face down on a clean pillowcase every night. If the benzoyl peroxide is something you've already used for a few months, or you want to add something else over the counter that is simple, you can add Differin or adapalene, which is an over-the-counter, very, very gentle retinoid. And retinoids are really good medications for acne, but they can be really irritating. So you want to start with something really gentle, allow your skin to get used to it. I usually say start every other night, just so that you're not as irritated. If you find any irritation, back off. Use it every 3rd night, once or twice a week until you can build up. The best skincare regimen is one that you can stick to and is going to be gentle, then it can be effective. If it's a lot of irritation to your skin and it's not something you can stick to, it's not going to be effective. So those are some really, really simple, inexpensive, and very, very easy to stick to skincare regimen. Every skincare product that you use, you have to wait 3 months to determine if it's actually going to make a difference or not. That's another mistake I make, is people just don't wait long enough. After 3 months, if you've been doing this religiously or your teen's been doing this religiously and it's not getting better, please reach out to your doctor. Talk to us. We are happy to help with prescriptions and try to help get a even better resolution to their acne. This is for someone for mild to moderate acne, by the way. If you have severe cystic acne, you need to see your primary care provider or dermatologist and talk about something maybe even orally that's going to work better for you. So this is for mild to moderate acne on the face, chest, arms, and back. One more thing I would add, if you have the kind of acne that is those tiny, tiny little fine bumps, mostly over your forehead, but it can be everywhere. It doesn't look like the pustules that typical acne does. They're not super red and inflamed and cystic. They're just really fine bumps. The best thing to wash your face with is Nizoral shampoo. That is a form of a little bit of a fungal acne in most cases. Nizoral shampoo for a face wash once a day works wonderful for that as a first-line treatment. So I hope this helps. Talk to your primary care provider or dermatologist if you need something more specific than this, and take care.